When I first came to Portland last December, I was just in a really hard place, just very dark and isolated and not knowing what to do or how to move forward. I was alone, like I was alone.
Then we were on the verge of homelessness or homeless a few times, and just being low income, just addiction issues, single parent, trauma. It's just a lot.
I'm a survivor of childhood sexual abuse. I contracted HIV, and that's where I really started to just explore the world of illicit drugs. I don't know if I really want to stay around for this, and really contemplated ending it.
When I was a child, I was a member of the LDS church, and realized that I was gay. If the church didn't accept me, how's the gay community going to accept me? And so when the drugs came along, I didn't care if I fit in. That's what I've been doing the last 5.5 months, is working on recovery. And it was done. I was done.
Quest was like a lifeline. Suddenly I had things that I could do, ways that I felt like I could help myself to keep moving forward. It's just like this world opened up.
It's like, have you heard of Quest? Quest has yoga and acupuncture. I'm like, what's Quest? What? No way.
I mean, it was all kind of surprising, all the things that were available.
They hook you. You go in for one thing and then you hear, oh, they do this, they do this too.
Opening up to the uniqueness of each individual person and how it's going to look exactly your own way every time. And the more space there is for that, the more potential there is for the growth and the healing.
They really want you to experience life and not just go into treatment.
I love that sense of community that's being built. That's very new to me, where like I can walk in and I like have people that know me, that are smiling to see me and I want to be with. And I love nutrition. I love helping out with it.
Companionship, just community talking.
Why I like it so much, because it reminds me of my grandma's cooking, because she'd always cook for the family, and then watching her face glow with watching us enjoying the food.
There is no place like this place. There really isn't.
It's really powerful to feel so taken care of, and valued is a good word for it.
This is a family here. It's not just a business, but it's a family.
Feeling this shift, and I just see how everything has come together to keep me moving forward, to enter into this new stage of my life, and how Quest has been like such a key piece in that.
Going from a little gay boy in an LDS church, not fitting into a community that accepts me for who I am, is a big deal for me.
Today, because I'm integrated and feeling my feelings, I can actually feel love.
People say a life beyond their wildest dreams, and it's like, my life isn't quite there yet, but my life is getting there. It's like, I never thought, I could do a lot of this stuff I'm doing, so.
They just provide so much to create my own story, supporting me in my journey, not to make it a certain way, but to meet me where I'm at. So I have all of these things that I can take and utilize to create this beautiful thing for myself.
Because one of the most fundamental things is that when and I think I can speak for a lot of my peers, are here, we don't feel like we're being pathologized. I don't feel like I'm a patient. I don't feel like I'm sick, that I'm going to my place to fix me. I feel like a member of a community coming to see my friends, and coming to see not my doctors and not my keepers and not my judgers and not my gods which dictate my health. I am seeing people who co-create my health with me.
I had a dream, and the dream was a very powerful dream in which I dreamed about Lucas, and I dreamed a dream about some changes that were important for him and his healing. There should be a healing center, and that Lucas and I should form this healing center, and that it should be done now, if at all possible, because there was a need for it. And again, I got the part if I was willing. I didn't have to do it, but if I was willing, it would be a good thing. So after I had the dream, I thought about it, and I thought about telling Lucas the dream. And I thought, well, I'll tell him the part about his own healing and about having dreamed about a healing center. So he came up to me in the morning and he said, Lusijah, I had a dream. And you were in it and you're not going to believe it. And so he began to tell me the dream. And the dream had the part about the healing that he needed to do as I had dreamed it. And then he said, and I dreamed about a healing center and the importance of creating a healing center. And I'm thinking, oh my, that's a big dream.
I'm an osteopathic and naturopathic physician, and I started officially with Quest in 2000, and we've been meeting in living rooms with Lusijah and some of the other original Quest people and a lot of other people trying to create an integrative practice for a couple of years before then on Sunday afternoons. And I do mostly body work, hands-on osteopathic manipulative treatment, a lot of cranial work, but I also have training in group therapy. And so I co-lead a lot of groups and retreats with Lusijah and with other folks at Quest. Quest is different from the other models of integrative clinics that I've seen. I've worked in hospital systems and on an Indian reservation and in different integrative offices, but we are really committed to having it be a center where everyone works together instead of independent practitioners in there, and really having people work on a collaborative basis, support each other, and develop programs together and independently. And we also really, we give a very high level of care. In terms of expectations, we have a lot of grants where we have to follow certain parameters and we have to prove that we're giving high quality of care, but even people outside of those models, and each different practitioner is really dedicated to giving the best care that they can. And whether it's a mental health person or a peer mentor or a physician, it's just like in some clinics, it's easy to kind of slide a little bit and say, oh, it's more important that we look at this aspect, and I'm not so worried about these other more technical or clinical aspects or whatever it might be. But everyone there is just so dedicated to really making sure that everything's done in a really good and sound way, if that makes sense. One of the things that I love the most about Quest is that we do offer different approaches. And so we offer naturopathic medicine, which I'm also a naturopath, and I work with some wonderful people who can provide herbs and talk about diet and things like that can support people's healthcare. We have a lot of Chinese medicine folks there, and that is really fundamental for our program. We also have a pain program to help people with chronic pain. We have a program for people who are dealing with addictions. And our biggest program, and we have an HIV program that is carried through forever. We have so many HIV positive folks and a lot of GLBTQ folks. And so really creating programs that are unique to their needs. And then the mental health team is the biggest team we have. And just a lot of really fundamental mental health care and options for people.
When you have a wellness focus, it's a very different thing. It's always looking at and believing that people have the capacity for wellness with whatever illness that you have. And that wellness relates to how do I show up today in the fullest way, and how do I receive the guidances to experience this illness and all that I can do to heal, either into living or into dying. So in a wellness focused healthcare center, we're not just working, say, in our alcohol and drug treatment program for a person to be clean and sober, so to speak. We want for them to be that, but we want for them to really feel the shift to being guided within and on a healing path. So that feeling of recovery is something that's profound. It's recovering who you are. I want medicine, or the work that I do, to move from a model where I look at a person by the disease they have to looking at a person by the health and wellness that is within them and can come through, and that by being present with them, feeling the spirit within my own self and creating that atmosphere and belief. And then when you have others that feel that and believe that too, it really supports people being on a healing path and life being able to be lived more fully. And I'd say living life fully is one of the things we hope at Quest to inspire and support.
So I think that being at Quest Center is unique from other clinics and places that I've practiced, because it really is founded on a principle of allowing that sense of spirituality to come through in everything that we do, to whatever extent it feels right to, and in different ways with different patients, and each practitioner is unique in that sense. I feel that when I'm with a patient, I am able to connect with them at a really deep level, and really there's a sense of connecting at a soul level, a spirit level, a heart level often. Or if someone, it depends on what the patient is asking for and looking for that day. But I feel that the Quest is a place where my spirituality can be an active participant or an active part of the field. And I feel like each of us who work there are really committed to the same thing. I wouldn't say that everybody comes in thinking I'm going to bring my spirituality to it, but I think that because there is this groundwork of really caring for and seeing the patient as part of a greater whole and in a different context, I think there's a spiritual aspect to what we do on a daily basis and on a moment-to-moment basis. It's not that we don't have our challenges and conflicts, because those are part of everything that anyone does, right? And especially being in a group, the more people we have there and the more things that are going on, the more things that come up. But just having that commitment to working from a spiritual place and to finding deeper meaning and deeper connection really flavors what I do. And Lucia's founded Quest from that place, and it's really carried through. And I think it's been a huge part of what's kept me there.
One other thing that through the years of time, there's certainly have been a number of people who have come to Subud, and it is really gratifying to sense that too. That I believe every person has the spirit within and can feel that awakening in whatever way it happens. But it is really nice to have people who join us in our Subud community. It has also been interesting because since we work a lot also with the gay community, uh, certainly we are probably the Subud group that has the most gay people, and learning how to have that be a part of who we are as a Subud community, and making room for more diverse ways of being and presenting, I think is key to what all of us need to do. And it is actually part of my receiving that is a role that I have, is helping there be more openness and a greater sense of love for how each of us comes into this world, and a love for the LGBTQ folks and all people. So I see that as being an important part of what I've received to do in the Subud world too.
For me, it's completely up to the patient, the person, and where they're at and what they want and how they want to be supported in that. Some people just want to come to the clinic and have a place where they can come and be supported in terms of treatment, physical treatment that helps them feel better in their bodies. And some people need and want more of a wraparound care. We've had a lot of groups to support people, and really working with people to support their physical, emotional, and spiritual beings. And then I've done, as people get more depleted and need more home care, I've done a lot of home visits and really helped create an environment in their home or wherever they're at where they can really feel supported. And to me, that's such an important time in people's lives for the patient and the person. I keep calling them patients, but for them and their families, it's just such an important time, helping them find whatever they need to hopefully be at more peace and make that transition more easily, and in whatever way feels right to them. It's such a unique thing for each different person.
Our culture is not one in the United States that I believe deals with death very much. It's kind of like the problem, not something that is a natural part of living. And I think because Quest has a wellness focus, it's looking at death as a part of life, and that to trust that within each of us, we have the capacity, as we do as a child, grow and learn how to walk and talk, that there's the capacity when we're at another time, when we're dying, to be able to have the shifts and changes that are naturally there that support a transition. And that by having people around when a person is dying, and we have done some times of being with people dying together. In the early days of Quest, over 40 of our people died, and it was a community time where people would choose who would be present and how to be there. And I'm thinking of a death of a woman with cancer that Wendy and our naturopath and I and some community members were present. And this person made the statement that it was actually the best day of her life. She felt the most loved. And she was a person who'd really struggled and to stay out of being homeless, etc. And that beautiful feeling, we're in this together. This is a spiritual event, as every day of life is, but even in a bigger way. And I felt so moved by helping this woman have this transition. Um, I believe much more that my death will be something that I can do in a peaceful and loving way, and having been with many people who I have experienced that with. In the last 5 years, I had the experience where somebody had called me, actually from Missouri, and that's in the middle west of the United States, and a fairly conservative area. And a person was wanting very much to learn more about supporting the process of death and dying. And so a woman and her mother talked to me for some time. And I stated that I'd be glad to talk with them and give them some guidance and support along the way in this dying process that the mother was going through. She was in her late 80s and had been very much an activist and a very special person. I actually never met Edna, the daughter, or Claiborne, the mother, but they were wonderful people that I supported through a process until the mother did pass away. And I did it because I received it was the right thing to do. Just have these conversations. It was never a build for thing. It was just a thing as a human being asked to help people in a trying time and kind of prepare for dying. And 2 or 3 months after the death of Claiborne, her daughter contacted Quest and talked to our director, David, and I, and gave a donation of $250,000. I had no idea that they had any money at all, of course. It was something I received to do. That money was incredibly helpful in helping us get through the pandemic, because we were going to have to lay off a number of people, and it was just going to be challenging to be able to keep our organization running. But I would say, being with Quest for a long time, there are miracles. Actually, every person is a miracle. But then there are those miracles that happen that you just know there's more to this when you trust, when you believe, when you put your heart into it and say, I'm here. The last 5 years, we also, through David's efforts and others, have established the first LGBTQ focused housing for folks in addiction treatment. And it's just been really a wonderful thing, actually. Many of the people from our Portland, Oregon government came to our opening of this to really celebrate that we are working with communities. We're asked by the county that we're in to be the supportive system for an African American specific pain program and alcohol and drug treatment program, because we've been so good at our finances and at our infrastructure, and people trust David's work. So we are working to have a group called Miracles, that is the African American specific drug and alcohol and pain management program in Portland. Quest has this year purchased a building. So we will have a building that has over 14,000 square feet. I'm not sure what that is in meters, but it will be able to house all of our programs together. And so I think this will be a year where we really come into being what we've always wanted to be. So I'm very excited and happy that that will be able to happen.
Working to create a specific trans program. We have several people who are trans, but we're really working on creating the funding. Right now we have several big changes with a new electronic record and a new building that we're buying and things, but we also are always working on how do we want to deepen and expand in terms of our programs, and creating a safe space and programs that are really dedicated to people who are trans is so important, and it's so much a part of what we do, but to be able to do that in a deeper way is really one of our next openings and our next commitments. We have a big commitment to making our services available to folks from all different socioeconomic backgrounds. So it's not just for people who have money. We have a lot of grants, and we really spend a lot of time getting resources so that we can provide it to people who don't have money. Some of our people are temporarily or long-term houseless, and we support them. And anyone, we want to make our services just really available for people and not have it be dependent on who has money, how much insurance do you have. And we have a lot of we have a sliding scale, payment plans, and we do some services for free if we need to, and we just make it work.
We have like a six-legged stool. We've got publicly funded dollars in the United States. That's Medicare and Medicaid. Medicare was started in the early 60s, and it was for blind, aged, and disabled people. The following year, Medicaid was set up, and that was for people under a certain poverty level. That under President Obama and the Affordable Care Act was expanded. We don't have universal health insurance like in France. It's all privatized and very, very bad. So we always have to look for creative ways of utilizing those systems to help marginalized people. We then get contracts with municipalities, the county, the city, the state. And then we have grants, and then we have donations. So those are our major funding sources. There's new money under the Biden regime here, President Biden, that is coming from the federal government, coming down into the state level for housing. And that housing money, I was able to form a coalition of other like-minded organizations, and there's millions and millions of dollars. So in Portland in particular, the cost of housing is obscene. It's very expensive. Most working people can't afford it, let alone non-working people that come from oppressed and marginalized populations definitely can't afford it. So we're looking at coming together as a coalition to get a hold of some of those dollars so that we can create more housing and services around that housing for people who come from LGBTQ plus community that has either substance use or mental health disorders. That means we have to diversify how we can make sure that the people that need it the most can get in to see us. And that's the Medicaid and Medicare folks. They're the people that have the least amount of resources. And it's actually closer to 80% of the people. We do have contracts with different insurance agents, insurance companies for people that have money, but it's not really our mission. You know, our mission is to serve underserved and marginalized folks. However, we like to have a mix so that there is a more, it's not, there are different people of different backgrounds and skill sets so that people can interact with different folks. We have very dedicated people, very dedicated staff that work very hard. So when I got to Quest 16 years ago, there were 6 staff people, and now there are 73 staff people, and we are in separate counties, and we just bought a building, and we've expanded I think I might have had a little to do with that. I told them I would only come on for 9 months just to help them out. And now I'm here 16 years later. So before I got there, they needed somebody that understood the different funding mechanisms, was able to marry the community and health aspect with the financial aspect, so that we could develop the programming and make sure we had sustainable resources for it. Before I got there, there was no alcohol and drug program. There was no housing. There was no development. There was no movement, yoga or qigong. There was no pain program. There was one person, who did all of the billing, the office stuff. And now we have a business office of 5. I've always been in public health. I've never been in a private practice. So it was always important for me to understand how am I of service to people that need it the most? And you can't do that on breathing and on goodwill. You've got to be able to pay people, you've got to be able to pay the rent. And so I was able to bring a certain acumen from my previous experience to Quest to bring things together.
I'm Sunrisa Gleason. I live here in Portland, and I've been going to Quest for 5 years now. I was raised in a very strict evangelical Christian household that had a lot of abuse. I didn't have the coping skills. I didn't know how to deal with life. The only way I could get by was the alcohol. I'm a mother. I was ashamed. I was so ashamed and afraid to open up, afraid that somebody was going to take my children, that they were going to judge me, that they wouldn't want to help me. I've been trying to stop for 25 years. If this doesn't work, I don't know if I'm ever going to get clean. So I got sober during a time of COVID. I thought that would be impossible. I thought, oh no, we're in a pandemic. Oh no, this isn't going to be possible for me to do right now. If anybody can hold it together during the pandemic and still provide good services, it's Quest. And they've proven me right. They already built that trust with us. And so even though this is still so new and so ever changing every day, they've created this thing where we still feel as safe and confident in the process as we possibly can. From the moment I walked through the doors, I've always just instantly felt relaxed, like these people care, I don't think I would have tried with any, if I didn't trust Quest so much after the amount of trust that I'd built with them over the years.
But she kind of went backwards, and so she started with naturopath services, mental health services, and then came to FSR and got all this help throughout them, and then they referred her to us when she thought she was ready to be able to quit.
I have meetings 5 days a week. They still offer 2 times a day. They've managed to virtually provide all the services.
Completely honestly, I've never met her in person. We've been on Zoom this whole time. She started at the time of COVID.
And they've been very upfront and honest with us that, hey, we're human, we're figuring this out.
Because this is new for everyone, right? Just because we're a business or a service doesn't mean we know how to navigate a pandemic, right? So
Quest in response to the pandemic has been very quick in terms of changing around policies, changing around procedures to make sure that client and staff safety are the #1 priority.
And my first initial thought was, it's not just me, we're all going through this.
I feel proud. I feel very proud to be able to work with these individuals and work with my team and work with Quest as a whole, helping people through such a difficult time.
But I also, as a peer, I'm able to text clients, and so I try to stay very interactive with them and let them know what's going on all the time.
We have constant contact. We check on one another.
Maintaining that sense of community in spite of the distance, I believe that's why Quest is thriving during this time of COVID.
I don't see Quest as a job. I see it as a resource, and I see all of us as caring humans doing human work and offering services.
I had clients wishing me happy birthday, clients who I talk to regularly just to check in and see how they're doing. And this is a position that I've always wanted to be a part of, and this is a community that I've always wanted to be a part of.
I don't want to escape from my life anymore. I want to be present in my life. I would see pictures of my friends' gardens and I would just cry because I thought I'm never going to be able to do that again, and I loved that so much. And since getting sober, I've gotten that back. I'm enjoying fresh tomatoes off my plants from the front yard right now. You know, we've all been so busy, and we all see this self-care thing as a luxury that can be put off until we have time. And then we never seem to find the time. And now we have time, and it's time to practice self-care and get used to it, because we all need it and we deserve it. And your community and your family deserve you to take care of yourself too, because you're a much better person when you do, I promise.
I started in Quest around 95, 96. And I came to Quest, I'd sobered up out of the bar community 10 years before that, approximately. But I had a partner that left me when I was getting sick. I had 18 T cells, and he left me because it scared him that I was so sick. And I came to Quest kind of on the angry side. And Quest saved my life. It was during a time when AZT was killing a lot of us because we were taking a whole lot of it, way too much. And I decided on my own to stop. The doctors didn't like that, but I noticed that the people who were still on it were the ones that were dying the fastest and getting bone marrow transplants. And I stopped, came to Quest, and and Lusijah specifically kept us alive. With the different modalities they used, we were taught through hypnosis to dream about fighting our disease. And then we had a lot of other things that helped our bodies out. I got infusions of huge amounts of vitamins, and I got acupuncture, and I got shiatsu massage, and naturopathic help, and I got Chinese medicines.
I joined Quest when it was an experimental support group. There was about 8 to 10 guys in it, all with HIV. and it was back in the 80s. And my friend told me about it because there were no drugs at the time, and I didn't know what to do, and I was freaking out. And my friend Bob, who was a member of that, took me there, and I immediately became engulfed in, thanks to Lusijah, in my healing process, and was also killing the HIV in my body without drugs because of Lusijah and psychoneuroimmunotherapy. And pretty soon I was dreaming about just healing, and killing the virus in my body. And it got me all the way up to where there was AZT, unfortunately, which took me down several notches. And then the doctor took me off of them very quickly. And then it was Quest that was instrumental in bringing me back. I really had a hard time communicating with people and stuff. It was devastating to my I don't want to say psyche, just my intelligence level, So they worked with me with my memory and my synapses and a lot of different brain work. Definitely. Mm-hmm.
A year after I was in Subud, I was having a kind of a spiritual dilemma because I was actually more cognizant after coming to Quest and where I was in my life. And Lusijah told me about Subud. And of course, Subud is an organization that doesn't really evangelize, which I appreciated because all the other religions do. And I tended to run, probably because it's not a religion, and told me about the Ladihan and how that worked. And that sounded really enticing to me. And so I went to a help to find out about it. And I continued with the helper for almost 2 months before finally being opened. And it was magical.
I was pretty agnostic about believing in God. And when you're that sick, just in order to heal, I had to believe in first I had to believe in just the word belief. Like, I didn't understand that word, to wholeheartedly put your body and soul into believing that something magic is out there. And I had to get from point A to point D in my healing process. And I didn't know what point B and point C were. I just had to believe that that this would take place, and that's when I was introduced to Subud, and it was just the perfect puzzle piece for me to have a whole existence in my community and my healing. So does that make sense? Probably not, but
So my early days also were the early 80s. I was already doing therapy with Lusijah and I've done on and off. I've continued with therapy, and so I did have breast cancer, and I did join Subud, and that was all about the same time in the early 80s. So it's been a tremendous support, and continues to be part of my life, even now. My work with Lusijah, we have, I guess you would say, my malady, if you will, has been depression and anxiety. And I really feel that I turned a corner that would not have been turned without her support, without the multitude of workshops, the psychodrama workshops, which were transformative, to say the least. As Greg said, I think when you enter a weekend with a room of strangers, and at the end of the weekend, it's as if you've known each other forever. It's a deeply intimate sharing time that I can't really compare it to anything else in my life. During that time, I was a single parent, and the divorce was a part of the process. And Subud has been, it's hard to describe really. But I would say that, it's definitely a part of me now, and I claim it, or maybe it claims me.
Inclusiveness, so I know from my part, there's so many more people there. It started with mainly gay men. And Lusijah had us vote on whether, I remember this time so clearly, for the men to vote whether they wanted to include the women who had breast cancer. And it was like, this overwhelming yes. Yeah, it was amazing.
But we had women with HIV that were in the group as well.
Yeah, we already had some of the women there, but they wanted to start, like a program. They wanted to bring a lot of women in, and everybody. We said, of course.
It's an organization where I always felt like when I went to the doctor or wherever I went, and I was in need of healing, people would always reach down, here you go, we're so sorry, take this and move along, and it's like the first time where you're they just bring you in and you're part of it, and you get what you need out of it. And if it's not there, they'll create it. I mean, it just feels like a magical realm for healing where you're not this victim, sick person. You are a protagonist going in to get what you need to survive and live a healthy life.
And Quest for me is certainly not a job, and never has been, or I would certainly not be there at this point in my life. But I love doing the work. I love being with the people that I see and watching them be inspired or go through the struggles and feel supported. And I love working with people like Wendy, who are as committed as I am. That means a lot. It's a different way.
Mm-hmm. That's absolutely what's kept me there for so many years, is the commitment and dedication and that love and spiritual aspect within the people that I work the most closely with, Lusijah and other people, and feeling that inspire other people or other, we have lots and lots of practitioners now who come from different places, but just knowing that there are people there who really hold that image. And Lusijah having been our founder and creator and having been there for so many years, she's still the one who sees more clients or patients or whatever you call them. She sees more people every day, every week than any of us. None of us can keep up with her. We're always saying, how does Lusijah do that? How does she keep doing that? And you can just see you know, we all get frustrated with things like our new electronic record program, but it's also such inspirational work, and Lusijah really holds that for us so that we all can do our best work.